A small cut could kill an ancient human. Bacteria could enter the wound, spread into the blood, and cause death without anyone understanding what was happening. Yet some prehistoric people survived shattered bones, major operations, and even amputations. Their medicine was primitive, painful, and often dangerous, but it was far more advanced than it looked. For most of human history, there were no hospitals, no x-rays, no sterile operating rooms, and no antibiotics. If you were injured, the people around you had only their hands, stone tools, animal materials, plants, fire, water, and whatever knowledge had survived from earlier generations. That sounds hopeless, but the archaeological record keeps showing us people who lived through injuries that should have ended their lives. The first thing ancient humans had on their side was the body itself. Blood can clot, skin can close, bone can rebuild. The immune system can destroy many infections before they spread. Most small injuries heal without modern treatment. If the bleeding stops, the wound does not become badly contaminated, and the injured person gets enough food and rest. Ancient medicine did not create healing. It helped the body survive long enough to do the work, but that first step was never guaranteed. A deep cut could sever an artery. A puncture could carry dirt and bacteria far below the skin. An animal bite could crush tissue and leave saliva inside the wound. A broken bone could tear through muscle. Without treatment, blood loss, shock, or infection could kill quickly. So people probably learned the simplest lessons first. Press on a bleeding wound, remove visible dirt or splinters, rinse an injury when suitable water was available, cover it with clean material, keep insects away, stop the injured person from putting weight on a damaged leg. They did not need germ theory to notice patterns. They only needed memory. A wound that became hotter, more swollen, more painful, or foul-smelling was going in the wrong direction. A person who started shaking, became confused, or could no longer drink was in danger. Ancient people could not name sepsis, but they could recognize that someone was getting worse. An abscess presented a different problem. When infection became trapped under the skin, pressure and pus built up inside a painful swelling. Even without knowing why it happened, people could observe that some swellings improved after they opened and drained. Cutting into one with a stone blade was dangerous. It could release the infection or push contamination deeper and make everything worse. But the basic idea of opening, draining, and covering an infected area may be among the oldest forms of practical surgery. Once again, success depended less on understanding bacteria than on recognizing a pattern. Pressure remained dangerous until the trapped material had somewhere to go. Ancient people may also have changed their behavior around illness. A sick person might be moved away from food preparation, shared sleeping areas, or a water source. We cannot prove that prehistoric groups practiced deliberate quarantine in the modern sense, but repeated experience could still teach them that some illnesses seem to spread from one person to another. Medical knowledge was probably uneven. Some people would have been better at setting bones. Others would have known which plants reduced pain, which leaves irritated the skin, and which roots caused vomiting. Someone who had helped with many births would know more than someone seeing one for the first time. A healer did not have to be a full-time specialist. The person who remembered what worked would still become one of the most valuable people in the group. Imagine watching the same problem happen again and again. One broken arm is left unsupported and heals in a twisted position. Another is held still and recovers with better movement. One cut is packed with dirty material and gets worse. Another is cleaned, covered, and slowly closes. The explanation might be wrong. The ritual around the treatment might be wrong. But the useful part of the method could still survive. That is probably how much early medicine developed. Observation, imitation, trial, error, and stories passed from one generation to the next. Not every bad idea disappeared. Humans have kept ineffective treatments for thousands of years. But a method that repeatedly helped people survive had a better chance of being remembered. Plants were part of this knowledge, although the evidence is difficult to read. Leaves, bark, roots, and plant fibers usually decay. We cannot look at a Paleolithic skeleton and know exactly what someone placed on a wound. Still, ancient humans lived inside detailed plant worlds. They knew what could be eaten, what caused stomach pain, what numbed the mouth, what stopped diarrhea, and what made a person dangerously sick. Some plant chemicals really can reduce pain or inflammation. Certain resins can slow the growth of microbes and form a protective barrier. Fibers can absorb blood. Some bitter plants can affect intestinal parasites. But natural did not mean safe. Ancient people had no accurate way to measure a dose. The same plant that reduced pain could damage the liver, slow breathing, or kill a child. Prehistoric medicine was not a hidden collection of perfect natural cures. It was a mixture of useful remedies, weak remedies, rituals, and dangerous guesses. Broken bones left clearer evidence because bone survives. Archaeologists regularly find fractures that healed during a person's life. Some healed badly, leaving shortened limbs, twisted joints, or permanent pain. Others healed with surprisingly good alignment. A well-aligned fracture does not prove that someone used a splint, but it can suggest that the limb was repositioned, supported, and kept still. That was only the beginning. A broken leg can take months to heal. During that time, the injured person may not be able to hunt, carry water, gather plants, escape predators, or move with the group. Treatment was not just tying two sticks beside the bone. Treatment was weeks of food, protection, cleaning, and patience. One famous example is a Neanderthal known as Shanidar I, discovered in a cave in what is now northern Iraq. He lived tens of thousands of years ago and survived several serious injuries. His right arm was badly impaired. Damage to his body probably affected the way he walked, and he also appears to have had major hearing loss. Yet he survived into what was old age for a Neanderthal. We cannot reconstruct every day of his life. We do not know exactly how much help he received or who provided it. But someone with those limitations would have faced serious difficulty hunting, climbing, and moving through rough terrain. His survival strongly suggests that disability did not automatically mean abandonment. That idea becomes even more striking in the case of a young person found in Borneo. In 2022, researchers described a skeleton at least 31,000 years old. The lower part of the left leg was missing, and the remaining bone had remodeled over years. The research team argued that the limb had been deliberately amputated during childhood, and that the person survived for another 6 to 9 years. Think about what that interpretation requires. Someone had to remove the limb without causing fatal blood loss. The wound had to be protected as it healed. The patient had to survive shock, pain, and infection. Then the group had to support a person living in steep rainforest terrain with one lower leg. Not every specialist accepts the amputation interpretation. Some have argued that a severe childhood injury might explain the bones. Archaeology rarely gives us a perfect medical chart, but either explanation points to the same basic fact. This person survived a catastrophic injury for years. Prehistoric surgery also involved the skull. Across Europe, Africa, Asia, and the Americas, archaeologists have found ancient skulls with holes deliberately cut, scraped, or drilled through the bone. The procedure is called trepanation. Some openings may have been made after death, but many show clear signs of healing. New bone formed around the edge. That means the patient survived the procedure, sometimes for months or years. A few skulls contain more than one healed opening. Some people went through the procedure multiple times. Why would anyone do this? In some cases, trepanation may have followed a head injury. It may have been an attempt to relieve pressure, treat severe headaches, respond to seizures, or perform a spiritual ritual. The reason was probably not the same everywhere. The people doing it had no scans and no modern knowledge of the brain. But they learned how to remove part of the skull without always cutting too deeply. Their tools were made of stone, and that sounds crude. But carefully flaked stone can produce an extremely sharp edge. The larger problems were bleeding, contamination, pain, and knowing when to stop. Pain shaped almost every ancient treatment. There was no reliable general anesthesia. Some plants could dull pain or alter consciousness, but their prehistoric use is hard to prove, and the dose would have been unpredictable. A patient might be restrained. A procedure might be done as quickly as possible, or the pain might simply be endured because the alternative looked worse. Burns created another major challenge. Fire kept people alive, but it also produced constant risk. A child could fall into a hearth. Hot fat could spill. Sparks could ignite clothing or bedding. A severe burn destroys the skin barrier, causes fluid loss, and leaves the body vulnerable to infection. Ancient people had no skin grafts or intravenous fluids. Their best chance was to cool the injury, protect it from dirt, and keep the patient hydrated and warm enough to survive. Childbirth was even more dangerous. Most birth ended without surgery, but when labor went wrong, options were limited. A baby could become trapped. Bleeding could continue after delivery. Infection could enter damaged tissue. The mother might be too weak to eat or drink. Experience still mattered. Someone who had attended many births could recognize position, support the mother, cut an umbilical cord, control warmth, and notice when bleeding was becoming dangerous. But there were limits that knowledge alone could not overcome. This is one reason prehistoric life expectancy was low. People did not lack intelligence. They lacked reliable tools for the moments when the body could not recover on its own. Dental pain caused another kind of emergency. A cracked or infected tooth can make eating nearly impossible. Infection can spread into the jaw, face, or bloodstream. Evidence from Italy suggests that around 14,000 years ago, someone used a tiny tool to scrape decayed material from a molar. Thousands of years later, people in Neolithic Pakistan drilled teeth with tools similar to those used for making beads. A 6,500-year-old tooth from Slovenia contained traces of beeswax, possibly used to cover a crack and reduce sensitivity. None of this would feel like a modern dental appointment. There was no anesthetic injection, no electric drill, and no guarantee the treatment would help. But the goal is familiar. Find the source of pain and physically remove, drain, or cover it. Parasites were harder. Worms, lice, fleas, ticks, and intestinal infections followed humans everywhere. Visible parasites could be picked out or combed away. Smoke and certain plants may have repelled insects. Internal parasites were more mysterious. A person could suffer abdominal pain, weakness, diarrhea, anemia, or weight loss without anyone understanding what was living inside them. Some plant remedies may have helped. Others probably did nothing. Many treatments were tied to spirits, curses, or invisible forces. It is easy to dismiss those rituals now, but ritual could still change what happened around the patient. It gathered people. It created a treatment routine. It gave the sick person rest, water, food, and attention. Belief could not stop severe bleeding or cure a major bacterial infection, but care could keep a weak person alive long enough for the body to recover. Ancient humans still died from conditions that are easy to treat today. Infected cuts became sepsis. Complicated births killed mothers and babies. Tooth infections spread. Broken hips left people unable to move. Pneumonia, diarrhea, and parasites could destroy an already weakened body. Many treatments failed because people could not see the real cause, but saying they lived before medicine is misleading. Medicine did not suddenly appear when someone built the first hospital. It began the first time one human tried to stop another human from bleeding. It continued when someone held a broken limb still, carried water to a feverish person, scraped decay from a painful tooth, or stayed behind with someone who could not walk. Modern medicine gave us germ theory, anesthesia, imaging, blood transfusions, sterile surgery, vaccines, and antibiotics. Those discoveries changed the odds completely, but the foundation is much older. Observe the injury, reduce the damage, control the pain, protect the patient, give the body time, and do not leave the injured person alone. Ancient humans survived before modern medicine because they were not surviving alone. Their most effective medical technology was not a plant, a stone blade, or a splint. It was another human being who knew what to do and chose to stay.